Okay, we'll start our next session now. For which I'll invite Professor Dr. Hadi Baghaeri from Iran. He'd be talking on role of ultrasound in liver transplant. He is Associate Professor of Radiology. He got his MD from Shiraz University in 1988 and then got specialty in radiology in 1993, got fellowship in MRI from McGill University, Canada in 1996. Fellowship in interventional radiology and transplant imaging, University of Brussels, Belgium. Training course in RF ablation, Milan, Italy in 2003. Training in musculoskeletal intervention from France, and he's member of several journals and several associations and has presented papers in national and international congresses. I'll invite Professor Hadi Baghaeri.
Thank you very much. Before starting my lecture, I would like to thank Dr. Gilani and his other colleagues, especially Dr. Hamid and Dr. Hamidani, for everything and for this nice arrangement, and also for hospitality. And it's a great honor for me to be here and to be with you. I will start my lecture. It is related to liver transplantation. Shiraz is the center of liver transplantation in Iran. We have done more than 100 cases of liver transplantation, and I am radiologist of the team. So if you are facing with liver transplantation cases directly or immediately after or later on, you must be familiar with some features of some ultrasound features of liver transplantation. We will review some points. Ultrasonography is an important tool for preoperative evaluation of the patient for liver transplantation, both for donor and recipient. And also, it is a good imaging tool for intraoperative guiding for partial and or split liver transplantation. During operation, you must guide the surgeon to proper position of the segment or segments, and for better reduction of the desired volume of the liver. And during post-operative, ultrasonography is invaluable in evaluation of the patient with liver transplantation. We have some normal findings, some abnormal findings. We will discuss it later. For donor, it is necessary to evaluate the liver volume of the donor. It is usually, and the most popular tool is CT scan, but you can use MRI and also ultrasonography, especially tridimensional ultrasonography nowadays is a very good choice other than CT. Before transplantation, we must have a general idea about the texture of the liver to exclude contraindications and to see if it is suitable parenchyma or not. For evaluation of vascular architecture, we must have an idea before transplantation, but it is usually done with DSA and or CT angiography. For the recipient, we must know if the patient is a suitable candidate for transplantation. One major point is portal vein status. If the patient has portal vein thrombosis, partial or complete, there will be some problem during transplantation. It is not contraindication for transplantation, portal vein thrombosis, but it can prolong the procedure of operation and it can increase the risk of complications. For patients with portal vein thrombosis, intraoperatively, the surgeon must take a jump graft or other techniques in order to solve the problem of thrombosis, and it is necessary to diagnose the thrombosis before. Evaluation of parenchyma. We must have some idea about the texture of the liver, if it is occupied by a mass or it is infiltrated or everything. Hepatic veins. Sometimes undiagnosed Budd-Chiari syndrome and hepatic vein occlusion, it is necessary to have an idea about the patency of hepatic vein before transplantation. And as I mentioned, mass or nodules, for example, HCC or originating nodules, should be carefully checked. Unfortunately, ultrasonography has low specificity for evaluation of HCC and for differentiation of different masses at a routine examination. But some modalities, including tissue harmonic imaging and ultrasound contrast study, can help us in order to differentiate these masses. And before transplantation, we must have an evaluation of extrahepatic findings, including ascites, varicose vein, and or collaterals. This is a case of HCC, and you can see the mass here in the posterior part of the right lobe. And this is a huge HCC, one of our cases. And one of the common extrahepatic findings is splenomegaly. You can see enlarged spleen. And as I mentioned before, this ascites and evaluation of the portal vein patency is important in the pre-transplantation recipient candidates. This is a case of portal vein thrombosis. There's no flow inside, and there's prominence of the hepatic artery secondary to portal vein thrombosis. Ascites again. Postoperatively, we have some normal findings and abnormal findings. Ultrasonography has a major role in post-operative period and is used as a bedside tool. These patients cannot be moved to CT scan or MRI, and it is much comfortable to see the patient when the patient is in ICU or in the ward, and bedside procedure. It's very easy, and we are using it routinely. During the first hours or first days, it is ultrasonography and color Doppler evaluation of the liver transplantation is then twice daily, and later on every day, and later on 1 or 2 times each week. After transplantation, we must check parenchyma for local or diffuse abnormalities, for vascular problems, hepatic artery, portal vein, hepatic vein, and IVC. Every major vascular structure should be checked. Biliary tree and collections and masses should be checked. Nowadays, even the surgical techniques have improved significantly, but there is already significant complications, especially vascular aging. Ultrasonography is initial imaging technique for evaluation of the complications of liver transplantation. In cases where ultrasonographic results are inconclusive, confirmation is required, and in these cases helical CT or multi-slide CT has a very good imaging modality for these cases. CT is not routinely used in regular post-transplantation period, but we will use it in any cases who has complications which cannot be explained by ultrasonographic findings. There are still some insignificant or perhaps called normal findings. For example, right pleural effusion. Nobody says pleural effusion is normal, but it is so common in post-transplantation period that we will call it as normal finding. Mild right pleural effusion is a common finding, called normal. A small amount of free intra-abdominal fluid, it is not uncommon. Hematomas, a small amount of hematoma in the perihepatic or subhepatic region and in the liver hilum are common. Periportal halo, it was at first, it was considered as a sign of early graft rejection, but nowadays it is proved that it is not so reliable and should not be confused with biliary dilatation, should not be confused with